Hola, this is Gio. I'm ready for my 300 million stem cells treatment here at Dream Body Clinic.
All right, hello, this is Josh with Dream Body Clinic, and I'm here with our patient today, Gio. Gio works here. Gio helps me out with the phone calls, and he's been a good friend for a long time. So we always like to take care of the people that work here too. And Gio, you've had some health issues over the years, so what's going on?
Well, I feel right now better. I feel good. They just did the 300 million stem cells in the first IV. Now I'm receiving the NID plus the vitamin C after the first one. And problems I have with my stomach, pre-diabetic problems too. So we always recommend our patients, we always tell them what's good for their health. Now we're receiving it. Of course, I received it, some treatments before, but now I'm having this, which is one of our most important and biggest treatment for our patients.
Yeah, and this is the diabetes treatment, 300 million IV. It does depend on body weight. We recommend 1.4 million per pound of body weight, which is 3 million per kilo. And so this is the high dose. Now you're pre-diabetic, which is great because we're not quite at full diabetes, but you're right at that range. Like, where is your blood sugar at right now?
Well, goes among 95 to 110 during the mornings. But doctors always say, well, take care of it. Don't go over 125 or something. And I feel good.
Good, yeah. So you've just been keeping there, trying not to bounce off that mark and keep things in line. So the stem cells right now are going to go through a system. They're going to go straight to your heart. And everybody's afraid of all these other diseases, diabetes, COVID, all these things. And what they should be afraid of is their own heart. Because statistically, cardiovascular disease is the #1 killer. So we want to make sure people's hearts are good. And the IV does a great job of that. We're getting a lot of patients out of congestive heart failure and other related heart issues, also artery type issues. It's been great. So right now these are going through. They're going to look for the lining of your arteries. They should be textured like this wall back here. That prevents the bad cholesterol from sticking, but that gets worn down over time. We all eat too much sugar, too much alcohol, too much damage, things happen, right? That can start to wear it down and it starts getting too smooth like the picture back here. And the LDL, the bad cholesterol, sticks to it. Now it starts getting clogged. So the cholesterol really isn't the problem. It's the lining of the arteries. The stem cells, they find that when it's inflamed or damaged and they start guiding the repair of it. So very preventative for heart disease. And when those arteries get too clogged, that's a heart attack. So this will help prevent that. We've even had a few patients that did get completely clogged, and miraculously the stem cells help create new blood flow around the artery to keep them going. They still had to go in and get some surgery to, roto-rooter it out basically, but saved them from a full-on heart attack. So super, super beneficial to the heart. That's the first thing. Next, they go to your lungs. So a lot of these are going to get trapped there, close to 70%. They will eventually make their way through, but it's going to take a lot more time than the remaining 30%. But that's why we use such a high dose. There are some other clinics that will do, say, 40, 50 million, once, and then the next day do some. But what we found is by doing a higher concentration at once, we get a greater push through. We're getting more cells to the area, and it's a numbers game. We want to get as many cells to the area as possible to fix it. So those cells, even the ones trapped, they won't be useless. They're going to help regenerate any lung issues, and they interact with passing cells. So for diabetes, you got the B cells passing by. The stem cells interact with those. They send out special cytokines. They essentially reprogram them to work the way they should. Help with the insulin production, help with the pancreas. They're going to make things work the way they should. Hopefully keep the diabetes, from ever happening for you or for someone with full-on diabetes. Hopefully we're going to get that back in order. We've seen a lot of patients with numbers in the 200s, 300s, be able to get back down under 100 with a treatment like this. And look, it is medicine. It's no guarantee that's going to happen, but we have an extremely high success rate. That's the cool part. I think people see stem cells as this like magic bullet, and it can be. But I think people also need to know, look, this is cutting edge technology. It's medicine. If you give 10 people with a headache an Advil, I think the rates are about 60% that you're going to cure that headache. And that's like a D if you're in school. It's not a very good grade, right? So with this, like, we've got a much higher success rate but we just want people to be prepared. It is what it is. It's a great treatment, but you got to make sure it fits in your budget. You got to make sure it fits your treatment plan. Know what you're dealing with. And the big thing after this, get your diet in order. We've seen people that don't get their diet in order, and like the diabetes can come back. So they start eating too much sugar. They start drinking too much. That wears things down faster. So now we're to the lungs. Next, we're getting to the rest of the organs. I mean, you've seen it. You've talked to people with kidney failure. We've gotten out of it. We've seen people in cirrhosis of the liver get out of it. Seen all kinds of issues heal. Now, this won't do a lot for your joints. I think a lot of people think, oh, all my joints hurt, I'm just going to get an IV. But unfortunately, the cartilage, ligaments, tendons, they don't get a lot of blood flow. So you get some benefit, but not a ton. And then it has a profound effect on your immune system. Like we were just saying, help reprogram it. It's like hitting the factory reset button. And that's why we use such young cells. So it's been helping a lot of people, and we want you feeling perfect. So, and this too, with people that work here, we want you to know, like, we all do stem cells. This isn't the sort of thing we don't believe in. I know there's a lot of people in clinics out there that do this, and like, you can tell when you talk to them, like they don't even believe in the medicine that they're offering. And we truly do. I've done it. Gio's done it. I mean, we've even done it for your son, remember? Yeah. He did the facial treatment. He was dealing with some acne and stuff when he was younger. And, my kids have done it. My mom's done it, my brother. So we believe in it, and it's been helping a lot of people. Anything else for you, Gio?
Yeah, I think, as you say, well, this is a great treatment, but we have to be very compromised with ourselves too after the treatment. For living a happy and a healthy life, we have to be happy and healthy. Take care of what we get into our body. Don't drink too much. I mean, good food. It's good and cheaper though. And as you were saying, we try them before we tell our patients how it works into your body. The first time it was on my kid, as you said, just with one session, you got rid of all of the problems with his face, and it was amazing. I mean, I know there's problems by the age, but I lived it too, and it took me 5, 7, 8 years for getting rid of it in a normal process. But
it hurts your confidence at that age, right?
Yeah, that's right. And there was a lot of problems with his face. He was 15 years when you did the treatment, and then in 1.5, 2 months, he didn't have no more problems with his face, and that's amazing. I tried it then. In these shots I got by my belly button, and like many of our patients say, hey, I didn't feel anything. Well, in the 3rd week, you start feeling like a big boost of energy into your body for the next 3, 4, 5, 6 months. I mean, it's amazing. And as you said, we have to live it, we have to try it, we have to be in it, so we can recommend, we can tell what it's truth.
Yeah, I mean, there isn't a thing. I've done every treatment on the website, so I can tell people. There's been a lot I didn't have to do. I never need to do my hip. I did the hip, so I can tell people. It's a long, scary looking needle. It doesn't hurt though. So you can't tell those things if you haven't done it. So I guess our point is, we believe in what we do. We would not be putting these stem cells in ourselves if we thought there was any chance of like it not being a good medication, there being any problems. I just did the intrathecal treatment. That's into my spinal cord fluid 2 months ago. I mean, I don't think you can put any more trust in our cells and what we do than doing that, because the risks, the complications, if there was any sort of, bacteria, endotoxins, anything bad, you could kill someone with that. Like, it's into the spinal cord fluid. So we've got the best cells, the highest quality. We're helping so many people, and we do our best to give people the real info. I think we talk more people out of treatments than we talk into. We're just here to provide information. This has to be the right thing for you. We're not here to convince you, yeah, stem cells are the best. No, we've got a lot of data. We've got a lot of great testimonials. We've shown that these work. And, if you're willing to take that next step and try it out, this is a great place to do it. We're happy to help people out with that, answer all their questions, and make sure they have everything they need. So if you'd like to learn more, you can give me or Gio a call anytime. You can call the website at 833-445-9089. You'll get one of us. And we also have Martine, and Gio's brother Yvonne works here also, helping out on the phones. Or you can check out the website, www.dreambody.clinic. It's got all the information. All the treatments are on the homepage if you scroll down. Click on the hyperlink for the treatment you want, and prices are there, information's there. Everything you need to know is there. And then if you have some last little detailed questions, you call us, we'll answer, and we help people schedule to come down and get fixed up. So that's where we're at. So this is Gio. I'm Josh. Happy to help.
Would you like to share your name with me so he can call you back? It was great. One of our best treatments. I want to share that it was a little sleepy on that weekend. I had it only 1-2 days feeling like that, but on last Monday I was perfect, back in work. I feel now strong. Of course, it takes a little more time for start feeling the highest peak of the results, but we feel okay. We are happy, we're motivated, and we're ready to continue. Bye.